Listen up, if you can walk, please.
Members from the medical group, security forces, and fire department practiced their first response skills for the beginning of Samurai Resiliency Training Week. Organizers set up a scenario that involved participants acting as patients in critical condition after a plane crash. The training made members practice skills they normally don't perform every day.
There's a bunch of different things the med group practice here, right? One is change of environment, right? The med group is, most of the people in the med group are used to working inside the med group, where you have labs and x-rays and surgery and all those different things that you can do. Well, out here on the flight line, you can't do that stuff, right? You just can't. And so you have to think about it differently. The other big skill they worked on is triage. Triage is the racking and stacking of patients, about who's in what category, who needs to be treated when, and what kind of timeline you have in order to deal with it.
To put them to the test and make the training more realistic, the group simulated how they would respond during a base friendship festival.
That's a time when there would be a lot of civilians and bystanders, right? And so that changes the whole dynamic of the incident. And in this scenario, right, with something like the Friendship Festival, there's a lot more people around. And so you get a lot more injuries and that kind of stuff. And you also have to start dealing with the politics of having Japanese nationals who are injured and that kind of stuff. So it makes it, while we still have to practice all the things that we would normally practice, it adds another level of complexity and another level of risk that we have to take into account.
This exercise provided response members with the training they needed to know how to react in a time of need. Airman First Class Justin Stokes, Yokota Air Base, Japan.